This is Dr. Eileen C., an OB gynecologist currently working at the Chinese General Hospital and Medical Center in Santa Cruz, Manila. We're very fortunate to be having her today.
What do you recommend to young adults when they look up information regarding women's health on the internet?
Um, it's basically, as a patient, whether they are young or old, I just tell them to keep the communication lines open. I tell them, because some are afraid to talk to us because they say, my mom might call you. Because usually these younger children or these younger women usually are recommended by their mothers because, they're my patients, and then, or you go see my obstetrician. So I think one of the problems that they have is they're afraid that I might rant it out to their mother. So I always tell them, anything that we talk about, it will not reach your mother. It's a doctor patient thing that I cannot disclose it to anybody. So once they know that, then they become more open. So if they have questions, especially regarding relationships or sex, then they become more open. So those are the things that besides, and when they come in and they know that not no their mother will not know, then they ask a lot more questions. And sometimes I tell the mother to go out because sometimes the mother comes in, so
Right.
sometimes I request the mothers to go out so that it will be a more open conversation.
Oh, okay. Yeah, that's good. I yeah, I think personally I would also be uncomfortable to talk about stuff like that if especially when my mom is right there with me.
Yeah, I
Yeah.
know. It's a very common thing, of course the mother would like to go.
Yeah, of
Yeah, they're
course.
gonna go with you. Yeah, and then once they're in, the patient herself cannot like talk. And once I see that they're very uncomfortable, I usually tell the parent to go out. But and then once they go out, they become more open. So it's easier because sometimes if they hide stuff, it's very difficult for us.
Right.
Like for sexual, especially for sexual health. I do get patients who come in and said, no, the mother comes in and say, she has this and this, but she never had sex. You know, she haven't had sex and stuff. So when I let the mother go out, the girl actually already had a relationship before. So then the shift would be different. You know,
Right.
how you take care of a patient now would be different. Oh. So now I need to explain to her. Sometimes I would tell patients to, you come back some other time without your mom's knowledge. So that, it's because you cannot. Sometimes the mothers are really so, they're really so protective, and they really need to come. They really need to like know and stuff. So sometimes I
Right.
tell them, come back. Let's set an appointment. I give them my cell phone. Let's set an appointment some other time wherein your mother is not here. So because that's a very tricky topic. It's a very sensitive topic. So it's very
Right.
important that the patient is really open, you know, and she really tells you the truth.
Right. And it's also important that doctors get all the information they need then, no?
Yeah, because like for example, that one, her mother doesn't know that she's already sexually active, and yet she is, So then it now shifts to making sure that she won't get pregnant, making sure she won't get sexually transmitted infection. Let she needs to know this stuff. She needs to know the right thing to do. Not when she's already pregnant coming in and I don't want this child.
Right.
It's more of prevention also. That's the first thing I ask. Do you want to get, is it okay for you to get pregnant at this point or not? Because if they say, oh, it's okay, some women would say, even if they're like 20, 21, they're going to say, I'm fine getting pregnant. So, okay, it's their choice. And, when they say, I'm not yet ready, then that's a different thing. So now you talk about contraception, you talk about sexually transmitted infection. You talk about when you get pregnant, you might not be able to finish your studies, because sometimes they don't think about the long term thing.
Oh,
So you have to like explain it to them.
right. Okay, that's actually a very good insight.
Always keep communication lines open for any questions you may have for your doctor. Dr. Eileen does not disclose information about their patients, even to their family members, as it helps the patients be more open to topics such as sex.